2, 1.
Hey, hi guys. Thank you so much for joining. This is Tuesday Tips with Dr. Vidal, and we are going to be talking today about this treatment called Avéli. So Avéli is the new treatment for cellulite. So let's start by defining what cellulite is. So cellulite is basically attachments, fibroseptal attachments from the fascia or muscle to the skin. Why do we have that? So with gravity, with aging, our buttock skin will sag if we don't have those attachments. That's basically keeping that skin in place. But with genetics, weight fluctuations, some people may be more prone to have them visible. So those attachments kind of dimpling the skin in. And basically 90% of women have cellulite. So this is very, very common. So don't feel that you're alone in the world with cellulite. We almost all of us have some cellulite. But the bad thing was that until now, there were no real good treatments for cellulite. Why? Because we don't want to be aggressive and remove all those septal attachments and have then droopiness or sagging of the skin. And that's the downside of it. And other treatments that were in the market before were either not giving results, so you didn't see much change with the cellulite appearance, or one of those created long-term bruising or darkening of the spots that the treatment was done. So it was taken off the market. So now with Avéli, we've seen very, very good results because it's basically cutting those bands without the need to create that sagginess. So this is basically the device. So Avéli device, it is used for cellulite in the buttock and hip and thighs. Okay, so buttock and posterior thighs. So basically what it is a little cannula or wand that it's inserted through a very tiny incision, even smaller than a liposuction incision, so very tiny. And in the end you guys see this little light, which helps us identify the position of the tip of the cannula under the skin. So basically we mark you with you standing up, so we mark the areas of dimpling that we want to treat or where we want to cut those bands to release it up. When we insert this through that small incision, usually in the fold of the glutes, so where similar to the BBL incision is in the lower part, we insert this and the light transilluminates through the skin, and we can see, confirming that the dimple that we marked is the one that we're releasing. And that's the good part about this treatment, that is so selective that it doesn't cause that buttock ptosis or droopiness that was seen in other treatments that were more aggressive or causing blowouts, because this cuts the exact band that's causing the dimpling, because we're seeing it through the skin because the light transilluminates. So once we go in and we put this light in the dimple, we're in the position, we then bring out the scissor basically, or the actual device that's cutting it. So we go like this, and it basically creates this little 90-degree hook that basically I am going in the septal attachment and pulling it, confirming that it is the actual dimple that I want to cut, and then I hit this button and you can see how it cuts. So basically I put it down, put it in, closed. The light tells me I'm in the right dimple. I open the device, make sure that's the dimple again, so double confirmation, confirming it's a dimple, and then I cut it. And once I cut it, then I close it and I pull it out, okay? Most of the time, multiple bands need to be cut to release one dimple. So we do this a couple times, making sure that it's just in the perimeter of the dimple that we want to cut. And once we are not engaging or getting stuck in that fibrous band, we know that all that dimple fibroseptal bands were cut and released, okay? And we do this with every single dot that we marked before you are laying down, okay? So let's talk about cellulite versus skin laxity. And I think this is one of the most important aspects to know when we are considering doing the treatment, and knowing that not all the dimples or irregularities are actual cellulite. So skin laxity with time is gonna look like cellulite. When the skin starts to drop, those septal attachments are holding the skin, like I told you, to keep the buttock in place. So you're gonna start to see lines and irregularities. We can't release all of those bands because we're gonna end up with droopiness or blowouts of the skin. So that's a no. We can, some areas that are deeper, we can treat it with Avéli, but Avéli is better for the treatment of cellulite. Skin laxity can better be treated with energy devices. So this procedure can be combined with, for example, Morpheus. Morpheus is radiofrequency energy given through microneedles, and it can be done locally in combination with Avéli, okay? Avéli is a one-time treatment. Radiofrequency energy devices like Morpheus are multiple treatments, okay? Because that relies on the collagen formation in the skin to see a result in skin elasticity. So you can, for example, have the first treatment of the Avéli and the Morpheus, but then you'll require multiple treatments of the Morpheus if you're dealing with a combination of these two, which most of us have, okay? How do you differentiate if you have cellulite or skin laxity? The best thing to do is, if you see a dimple, you go in the mirror and hold the skin up, okay? You pull the skin up. If the dimple goes away, that's skin laxity. If you pull the skin up and you still see the indentation or dimpling, that's cellulite, and that will respond very well to Avéli, okay? Local versus general anesthesia. The good thing about this is it can be done under local in the office with minimal downtime. The other good thing is that because it is a short procedure, it can be safely added to other procedures during general anesthesia. So, wish you go, it depends on you, right? If you, for example, are having a mommy makeover, you're coming and having surgery and having it under general anesthesia, we can do the Avéli at the same time. But if you had surgery or you're not having surgery, you don't think about having surgery, you can still have the procedure under local anesthesia here in the clinic. If you're having the procedure here in the clinic, it takes some time, so plan ahead. You'll be here in the office for about 2 to 3 hours because it starts with the numbing. So we numb the area and that takes time. We give it time for the anesthesia to work and then we do the procedure, okay? So if you're doing it under local, plan ahead. General anesthesia, talk to your coordinator if you're having surgery because it can be safely added to almost any procedure except, and we'll talk a little bit about this, BBL, okay? The problem with combining it with a BBL is the blowout deformity. So if we have a dimple, right? So we have the skin kind of dimple down with those fibrous attachments that are attached to the muscle underneath. We cut this skin is already being stretched down, and the problem, or it can create, is what's called a blowout deformity, which is the skin, instead of being flat like this, it bumps up like that because I'm injecting fat at the same time. So all of this is expanding and this skin kind of goes out, causing a blowout deformity. So that's why it's not a very good idea to combine a BBL with Avéli. What patients are good candidates? Basically, patients that have 1 or 2 dimples, very, very minimal cellulite, are good candidates to combine it with Avéli and BBL. But for the majority of us that we don't have 1 or 2 dimples that are more than that, it's better to stage it. When to do it? So it depends. If you have a lot of cellulite, it's better to do the Avéli first, kind of release the skin a little bit, allowing the skin to redrape and giving it more space for the BBL later on. The Avéli should be done at least 3 months in advance prior to the BBL. 3 to 6 months is even better, okay? If you have not much cellulite, moderate cellulite, you can try to get the BBL first, because if the dimpling is because of skin laxity and it's not very severe, actually filling that space with fat may improve the appearance of it. So if that's the case, you can have the BBL first, see what still it's dimpling afterwards, because if it's cellulite, it will worsen with a BBL. If it's skin laxity, it may improve with a BBL, okay? Remember, these two are different. They look the same, but are different, right? This is attaching it down, so if you fill everything with fat, you'll fill everything up and the dimple is gonna look deeper. The skin laxity is because of lack of volume, so if you fill it, it's gonna look less, okay? So if you have moderate and you wanna check if it'll improve, do the BBL first, And 3 to 6 months later, you come into the clinic one day and have the Avéli treatment, okay? The good thing about it is minimal downtime, okay? So if you decide to come and have the treatment done here in the office, like I mentioned, you plan ahead, 2 to 3 hour appointment, but afterwards you can go back to living your life, okay? You will have bruising, you will have some discomfort. Usually the discomfort is for 1 to 2 days and then you're back to normal. The bruising may linger, okay? Remember, I'm cutting fibroseptal bands. Those bands usually have vessels with it. So those small vessels, we cut them and they bleed a little bit. It's not like a hematoma, but they cause bruising. And that bruising may linger for up to 6 weeks, more or less. Swelling may be present up to 3 months. Okay, so final result is good to wait at least 3 months. But you can work out, you can go to your usual activities, you can sit, you can go back to work. So it's very, very minimal downtime, okay? Important thing is compression. So it's not compression like a full faja, like a BBL, but because of the swelling and the bruising, you should have some amount of compression. What's the usual? Like short leggings is enough, and you can wear it for at least 2 weeks, and that's gonna help with the bruising and swelling to minimize that so you have less time with it, okay? We talked about downtime, and what about repeat treatments? Is this something that I'll have to be doing every year from now on? No, we're cutting the bands and that's it, right? If you have severe cellulite, like I mentioned, I can't cut all the bands because it may lead to ptosis or droopiness of the buttock. So you may need more than one treatment, but it's not because you need more than one treatment to address one dimple. It's because you have so many that we can address a certain amount in one intervention, and then you should come back to address other dimple, okay? But for one dimple to be released and improved, just one time treatment. So that's very good, okay? Okay, I'll take some questions now if you guys have them.
Yes, there are plenty.
Awesome.
Okay, doctor, can you do a rhinoplasty and a skinny BBL at the same time, same day?
No, not a good idea. So when I do a BBL, I want it to have the time and the amount of fat to be removed to be 4 liters at least. So in the state of Florida, there's a limit when you're combining procedures. And when you're combining procedures, you're able to remove just 1 liter of fat on liposuction. So that's not a good idea to be combining a rhinoplasty with a BBL, because then I'm going to be able to remove just 1 liter of fat, and that's not going to be enough to give you a good result. Also, time under anesthesia. A rhinoplasty is a procedure that it's very delicate and involves a lot of dissection of the nose and suturing, and it takes time. It takes me 3 to 4 hours to do a rhinoplasty. A BBL takes me 2 to 3 hours. So combine those procedures, we're gonna be on their table for 7 to 8 hours. So that's not a good outpatient intervention, okay? It's better to stage it, so you are under anesthesia less than 4 to 5 hours, okay? To decrease complications. And also, for BBL, you're gonna be laying in your face. You're gonna be sleeping down. I don't want any pressure on a rhinoplasty because it will affect your results, okay? So it's better to stage it at least 3 to 6 months apart each procedure.
How long do you have to wait until you can dry after BBL?
So at least 2 weeks, okay? So the first 2 weeks you shouldn't be sitting, okay? And at your BBL pillow, you can start sitting with it 2 weeks after surgery, okay? So what are the important things for you to safely drive after a BBL? One is that your pain is well controlled and you're not requiring any narcotics, okay? If you're requiring narcotics, you shouldn't be driving or operating any heavy machinery. Number 2 is that you feel comfortable sitting in your BBL pillow, okay? If you're not comfortable, you can't reach or you can't maneuver it, it's better to wait 6 weeks, which is when you can actually sit down.
Okay. How's the process to get a virtual consultation and how much is it?
Okay, so very good question and very, very easy, okay? So if you go in a link in my bio or go to our website, pureplasticsurgery.com, open that page and you're gonna see a link that it's called virtual consultation. You open that, it'll pop up a questionnaire and ask you for 3 pictures of the areas that you wanna address. Once you fill that in and send us the pictures, I evaluate all that information. I give the recommendations and a coordinator will give you a call. What's the cost of this? $0. No cost at all for my recommendation of the procedure. If you then want to schedule a virtual consultation or in-person consultation, there is a cost and the coordinator can help you out with that.
Ahora en español.
Ahora en español, la misma pregunta.
Es que varias veces hicieron la misma pregunta
Ok.
en inglés y en español.
Perfecto. So, ahora en español, ¿cómo hacemos una consulta y cuál es el precio de las consultas? Mira, la forma más fácil de empezar el proceso, a pesar de que tú quieras venir en persona, la manera más fácil empieza con una consulta virtual. Significa, vas a ir al website o en el bio de mi información en Instagram o en TikTok, lo pueden encontrar, le dan al link y eso te lleva a la página de nosotros, pureplasticsurgery.com. Ahí van a ver en pureplasticsurgery.com pueden cambiar la página a español. Hay una banderita española, si le dan ahí te cambia a español y hay un link de consulta virtual. Aunque tú quieras venir en persona, el primer paso es llenar ese formulario. Con ese formulario te va a pedir toda tu información, qué procedimiento quieres hacer y 3 fotos. Con esas 3 fotos y tu información yo evalúo el caso y te doy la recomendación de qué procedimiento es el mejor para ti. La coordinadora ahí te va a llamar con esa recomendación. Si quieres entonces agendar tu cita, ya sea virtual o en persona, ahí ella entonces te dice el costo de esa información, esa consulta adicional, pero la consulta inicial y la evaluación es gratis.
Seguimos en español.
Okay.
¿Qué puedo tomar para los nervios antes de una cirugía? Se les fueron varias. Te veo el viernes.
Ay, ya mismito.
Soy una paciente.
Mira, si tomas ya algo para los nervios, puedes continuar en tus medicamentos ya de ansiedad, de los nervios, como los estés tomando. No los tienes que parar, los puedes continuar hasta el día de la cirugía. Pero si tú usualmente no tomas nada, a mí no me gusta empezarte en algo para los nervios justo antes de la cirugía. ¿Por qué? Porque yo no sé cómo tú vas a reaccionar, cómo tu cuerpo va a reaccionar, cómo vas a estar de dormidita y yo necesito que estés alerta, que me entiendas cuando te esté hablando y cómo va a interactuar eso con la anestesia, ¿está bien? Así que si no tomas nada, es mejor hablar con nosotros, hablar con tu familia, tratar de hacer otras cositas para el manejo del estrés, caminar, hacer yoga, cualquier otra cosita, pero medicamentos, a menos de que si los tomabas, los puedes continuar. Si no, no es bueno empezarlo justo esta semana y súper contenta de verte, te veo el viernes.
How risky is the ultrasound guide BBL?
So it's not risky. So if you're not doing an ultrasound guided BBL, that's when the risk is, okay? So what is this? What is everyone talking about, the ultrasound and a BBL? So when we're injecting fat in the buttock area, that fat, if we're injecting it deep to the muscle or in the muscle, may travel to your lungs and give you a fat embolism. And that is a very dangerous and potentially fatal condition, okay? And that is what's been in the media and in the news about BBL surgery. So what do we know after studying this procedure for the last 5-6 years constantly? This started 2017, 2018 to go in media. So it's been a couple of years of cadaver dissections and studying autopsies of the deceased patients. So what do we know? If you're injecting above the muscle in the subcutaneous space, there's no risk for that fat to travel. So how do we ensure that we're not injecting in the muscle? By using the ultrasound. Ultrasound is a device that is safe, easily used, and for example, we use it in pregnancies all the time and we can see the baby. So it's the same concept. I'm using that, seeing the layers of skin and muscle in the buttock area, ensuring that when I'm injecting fat, I'm injecting above the muscle, not in the muscle, so there's no risk of fat embolism. That's it. Okay. Thank you so much, you guys, for the questions. I hope this helped understand a little bit of the Avéli treatment. If you're interested, give us a call or fill in a virtual consultation and you get more information. Our beautiful Jenny, nurse practitioner, does this when we're doing another local. If you decide to add it, I do it as well in the operating room, so you can add it to a procedure if that's the case. And if you have any other questions about the Avéli treatment, please drop them in the comments, and I'll see you guys next week on Tuesday Tips. Take care. Have a beautiful week.